Okay. And I think we're ready to begin.
I'm not sure I understand.
We're ready to begin. So I don't think there's any general announcements. Today we have Eric Kawaguchi talking to us. Any number of us, I think, could probably give an introduction. So others feel free to chime in if I've missed something. But Eric came to us, I think, about 2 years ago, is a postdoc in our division working with some of the topics within the program project grant, as well as on the T32. So he's had a little bit of flexibility, I think, to roam around. With me, for example, he did some work on sort of quantile loss in high dimensional data. His background, though, is from UCLA, getting both a master's and a PhD in the biostatistics group there, working with Gang Li and focusing a lot on survival and time to event in high dimensional data in that context. And so today he will be talking about recent advances in two-step hypothesis testing for G/E interaction and discovery. Okay, Eric, it's all yours.
Awesome. Good afternoon, everybody, and thanks for the introduction, David. I'm really excited to kind of talk about the research that I've been doing with primarily Jim and JP here in the division. But before moving to that, I kind of wanted to just briefly introduce myself. David already did a good job, but just for those of you in the department and division who may not know me, I, again, graduated from UCLA in 2019. My PhD was in biostatistics. This chief topic was on high dimensional regularization for high dimensional right censored computing risks data. Was recruited as a postdoc on the PO1 grant under JP at here at USC for a year, and then I moved on to the T32 fellowship I moved on to the T32 fellowship as a postdoc and was there since 2020. So I guess to recap my time here at USC very briefly, I kind of stratify my time here into three components. In terms of teaching and education, I started a survival analysis journal club here for the fall 2020 semester. Proved to be a bit challenging due to it being over Zoom and online, but as well as having people with a wide background in survival analysis, those who knew it really well to those who didn't. So it's kind of hard to kind of manage sort of expectations on that end. But in the end, I thought it went pretty well. I provided several guest lectures to different people, groups in the division and the department, as well as at different universities. I was a reviewer for several biostatistics journals, for example, Biostatistics and Science Medicine. And I'm currently an executive board member for the Southern California chapter of the American Statistical Association, where I'm currently holding the position of VP for Academic Affairs and Biostatistics.
Eric, if I interrupt just quickly here, your audio is not great.
Okay.
It's a little soft, I think.
Okay.
Not sure if others, I think Duncan mentioned it, and yeah.
Give me 1 minute, I might switch to a different audio system.
Is this better?
Yes, that sounds better.
Okay.
Thank you.
Cool.
Perfect.
All right. Awesome. Yeah. So basically, this is just sort of the recap of my time here in terms of teaching and education. I've also been doing a lot of collaborative research, as David has mentioned. So I've provided statistical support to several groups here within the department, most notably the LA Cancer Surveillance Program that we have here, the COVID-19 Pandemic Research Center, as well as the Division of Cardiovascular Medicine. And this kind of resulted in several published manuscripts, as well as a few sort of in preparation in the pipeline. And just to kind of add further, the latter two, the CPRC and the Division of Cardiovascular Medicine, I was able to sort of secure funding to provide statistical support moving forward. in terms of my methodological research that I've been doing for the past 2.5 years, it's if I could kind of summarize everything into one overarching theme, it's methods to model and analyze high-dimensional genomic data. So the first component was doing high-dimensional regularization, which is sort of up my alley since that was what my dissertation was on. So I was working both kind of what David was saying on this asymmetric lossy regularization using a quantile loss function. I also was helping JP with a project that was sort of started by a previous student of his that I kind of took and fleshed out the statistical rigor for on 2-level ridge regularization, incorporating external information. I'm also working with Josh Milstein on developing a parametric tail-end FDR estimator and corresponding confidence level estimator. That is sort of, it's going. I'm almost done. I just need to finish writing the rough draft for that. But that project is nearly complete. And then lastly, sort of the main part of this talk that I'm going to be talking about is improving power for genome-wide interaction scans. This is work that's sort of co-led by both Jim and JP, which has resulted into one manuscript that just got recently published in Stat Medicine, as well as one in preparation. This work also was the foundation for an SC-EHSC pilot project grant, as well as a PO1 renewal topic. So the first part of my talk that I want to talk about is 2-step hypothesis testing to detect G/E interactions in a genome-wide scan with the survival endpoint. This is joint work with my previous PhD advisor, Gong Li at UCLA, as well as JP and Jim here in the division. So the motivation behind this is that it's natural to suspect, at least in gene environment studies, that there may be a synergistic or antagonistic effect between genetic markers and environmental exposures on the outcome or disease of interest. And we typically call these things gene-environment interactions or G/E interactions. So why are G/E interactions important to understand and study? Number one, they can help determine patient subgroups that may benefit from the exposure. The wording is kind of weird here, but you could think of this, an exposure can be environmental or it can be induced. So an example of an induced exposure is a treatment. So it may be possible that patients defined by the genetic profile may benefit from a treatment more so than those without the corresponding genetic profile. On the flip side, you can also use these to sort of help identify subgroups with increased risk. So here's just a very simple example, a Kaplan-Meier curve with 4 different subgroups. Here, we're going to assume that the genetic and the exposure and the environmental exposure are both binary. So we can consider the genetic component as being the presence or absence of a particular trait, 0 and 1, respectively. And then the exposure here can be thought of as like a treatment, untreated and treated. So we can see based off of this simple simulated data set in terms of the estimated survival function, that for the solid lines, both black and gray, which corresponds to the untreated population, there is no difference in survival based off of the presence or absence of this genetic trait. But we can see that in the treated population, those with the dotted line, you have a survival benefit, right? Which is kind of expected. You expect this treatment to have some sort of positive effect on survival. And that's what we see here. But on top of that, in addition, we see that the gray dotted line represents the treated population and those where the trait is observed or present. So we can see that for some reason, having this genetic trait present sort of improves your survival more so than if the trait was absent, even in the subgroup of treated individuals. So, the idea of doing this type of G/E discovery is to sort of kind of help, scientists kind of narrow down the science as to, is there some sort of relationship going on with this genetic trait and this treatment that's allowing this improvement in survival. And so the idea of identifying these interactions is to sort of help develop these more focused studies. Now, this is a very clean example. In real life, things aren't going to look like this. You might have for a certain subgroup, you have worse survival. You might have maybe no difference in certain other subgroups. But this is just a general kind of motivating example as to seeing why it's necessary to identify these GWIS discoveries. Again, if you have any questions, feel free to chime in. I realized after doing Zoom for 2.5 years that it's very hard to look at the chat while in presentation mode. So I might miss questions if they're in the chat. So feel free to just chime in whenever there's sort of like a downtime in the presentation. So we're going to kind of consider the following gene environment study setup, which is a typical right-centered Sorella data setup. Maybe we have capital N subjects. T tilde is the observed Sorella time, which is just the minimum of the true Sorella time and the censoring time. Delta is the censoring indicator. EI here is going to be the exposure of interest, which for now we assume to be binary. And GIJ is going to be this, G is going to be this collection of N by M sort of genetic measurements, where GIJ denotes the jth gene. Here I'm using gene as a very broad term, but it can actually encapsulate one of many different type of omic measurements. So SNPs, biomarker levels, methylation levels, but just for consistency with calling it gene and environment, I'm gonna just label these measurements as just genes. And again, we're going to assume the usual right-centered Sorella data assumptions. Most importantly, that the true Sorella time and censoring time are conditional independent given both G and E. Identifying GWIS interactions across all capital M genes is a non-trivial task, both computationally and statistically, especially doing this in a multivariate fashion. There has been some work being done recently in sort of improving this field, but it still remains to be a non-trivial problem. So one convenient approach to identify these interactions is to model and test these interactions one gene at a time. And that's sort of the basis of a genome-wide interaction scan, or GWIS. The best way to sort of remember what a genome-wide interaction scan is to just remember the acronym backwards, which is that you're scanning for interactions genome-wide. But the idea here is that you're kind of estimating and testing interactions using some sort of marginal model or a unigenetic model, so to speak. For right-centered data, we typically look at the Cox model as a way to model the conditional hazard. And so for the jth gene, you can essentially fit the model that we have below here, shown in 1, where we assume that the conditional hazard takes on the semi-parametric form, where H naught at T is an unspecified baseline hazard, and that the genetic component, the exposure, and the interaction affect the conditional hazard through this log linear model. And we can essentially do this across all capital M genes. And what we're interested in doing with GWIS discovery is testing null hypothesis is gamma G sub J by E equal to 0. And you can test this across all capital M hypotheses. But the issue here is that we need to adjust our multiplicity since we're doing multiple tests. And the most common way to do this is a very simple Bonferroni correction, where you're testing the significance of the test statistic against a significance threshold of alpha star, which is equal to alpha over capital M, or the number of tests that you're looking at. In genome-wide scans, capital M can be tens of thousands, hundreds of thousands, even millions. And so your alpha star would be very, very small, and this will result in low power. So the question that we want to answer is, can we develop methods that simultaneously improve power and preserve the family-wise error rate? And this is where the notion of two-step hypothesis testing comes in. This is not a new field. I have not by any means invented this. This has been well studied for quantitative and binary traits, especially in the gene environment realm. But this typically provides greater power than the standard GWIS while still retaining the type 1 error. And the way this is done is, as the name suggests, doing 2 steps. So in step 1, you're filtering or ordering genes based on some independent screening statistic. I'll talk more about this later on, but just remember that there's 2 statistics, a screening and a testing statistic. And in step 2, we test the same null hypothesis that we had before, right? Gamma G sub J by E equaling 0. But instead of testing it at that significance threshold before, which was alpha over capital M, it's going to be tested at a modified significance level. And that modified level is based on the results from step 1. And there are several ways to do two-step hypothesis testing. I'm going to be talking about two that are kind of the more popular or well-appreciated ways of doing them. One of them is what I would call a subset-based approach. And this was kind of independently found by Cooper, Berg, and LeBlanc and Mercray et al. And the idea here is that we first define this auxiliary tuning parameter alpha naught as the screening threshold. And we let A be the indices of genes that pass step 1. And what it means to pass step 1 is to have a screening p-value, or the p-value corresponding to the screening statistic, to be less than alpha naught. And so we can see that A is going to be a subset, right? It's going to be a subset of the total number of genes that we have. And for each of these indices in A, we're going to test the corresponding interaction statistic against the significance threshold of alpha over the cardinality or the size of A. And in theory, if alpha naught is small, then the cardinality or size of A will be much smaller than capital M. And so instead of testing each testing statistic against the threshold of alpha over capital M, you're essentially testing it against a much larger significance threshold, which allows you to have a higher chance of detecting significant effects. And then for the set of indices that aren't in A, right? So we have two sets, right? The subset where we are included and the subset, obviously the complement. Those corresponding interaction statistics will not be tested. Or more specifically, they'll be tested against a significance threshold of 0. And this is important to retain the type 1 error rate. And this is one way that we can sort of improve power because, as I said before, instead of testing against alpha over capital M, we test over alpha over the size of A. But it still isn't that favorable because it's a very dichotomous choice, right? You're either tested or not tested. And that's sort of the kind of one of the main cons with subset-based testing. So there is another approach that's used as well, which is what I would call a rank-based approach or the weighted Bonferroni. And this is proposed by Laza et al. In 2007. In this approach, instead of doing a subset, you're in or you're out, it sort of bins these tests into different, it sort of bins these tests in a way that you prioritize larger effects and deprioritize smaller effects. So the way this is done is that you rank the M screening statistics in decreasing order. And then again, using some auxiliary tuning parameter B, which we would call the initial bin size. We organize tests into bins of size B, 2B, 4B, 8B, 16B, and so on and so forth. Sort of this recursive way of partitioning the genes. So for example, in bin 1, where we have a bin of size B, bin 1 has B tests corresponding to the B largest screening statistics, right? Since we're ranking them in decreasing order, the first 5 will be the top 5 largest screening statistics, also corresponds to the smallest 5 p-values, but those will be in bin 1. The next 10, right? So order number 6 to 15 will be in bin 2, and then so on and so forth. And for each bin, we designate a bin-wise error rate using some geometric series, such that alpha 1, or the alpha for bin 1, will be larger than the alpha for bin 2, which will be larger than the alpha in bin 3, and so on and so forth, such that the sum of this is going to be equal to the nominal level of alpha. And just like the subset-based approach, for each J in the specific set in bin K, we test the corresponding interaction statistic against the threshold of alpha K over the size of that bin. So for example, in bin 1, we'll be testing those 5 test statistics against a significance threshold of alpha 1 over 5. For the 10 that are in bin 2, we'll be testing them against a significance threshold of alpha 2 over 10. For bin 3, alpha 3 over 20, and so on and so forth. And so in doing so, you're allocating alpha in such a way where that the higher bins will kind of take up more alpha. So you have a higher chance of detecting a significant effect if you're in the higher bins, but at the same time, if you're in the lower bins, you may, just by the way it's constructed, you may have to cross a threshold that's even more conservative than the standard Bonferroni approach. But the goal is that if there are true effects, those effects should be in the top bins. Alpha naught and B, as I said before, can be thought of as tuning parameters. They don't affect the retention of the type 1 error rate, but their choice can affect the power of the study. And this was shown in a paper by Juan Pablo, I believe, in 2013. And there is no principled way of finding alpha naught and B. There are sort of rules on values that people use, but there isn't really like a one value that's best for all potential scenarios. Again, as I said before, the idea of the step 1, step 2 approach is to use a screening statistic to do the screening in the first place. So you use the screening statistic to find out whether or not you're in a subset. You use the screening statistic to find out what bin you're in. But then now the question is, well, what should we use as the screening statistic? And for case control studies where we have a binary trait, or even for quantitative traits, typically the marginal statistics are a popular choice. And since then, there have been several alternatives that have been proposed that are just combinations of marginal statistics or more complicated statistics to be used in step 1. But there's been kind of a good amount of research done in sort of improving step 1 in terms of what statistic to use. What's important to be able to retain or preserve the finalized error rate is that the screening and testing statistics have to be independent. That's the only way you can guarantee that you retain the finalized error rate at the nominal level. And that was shown for certain models in Dai et al. 2012. So again, that was for binary traits. For quantitative traits, this has been well studied. For temp event traits, it hasn't, and that's sort of kind of what I'm venturing into. So for the Cox model, we can parallel Kuperberg and LeBlanc step 1 approach. Again, they use a marginal statistic. So this will correspond to the following marginal model, where we only model using a Cox model, the conditional hazard based off only the marginal genetic effect. So a question that we have here, so we can use this beta G for all, j equals to 1 to m, use this for step 1, either do subset approach, either do the weighted approach, prioritize interaction tests and then test interaction terms with those modified levels. We could do that using this statistic. But the question to make sure that this is a valid 2-step procedure is to show that both beta G and gamma G by E are asymptotically independent. Now, again, I said that the Dai et al. Has showed this for specific models. More specifically, they proved this result for GLMs under a canonical link. The Cox model is not a GLM under a canonical link, and just perusing through the literature, there isn't a general result for the Cox model, at least for the specific screening statistic. And actually, in some of the numerical studies that we've seen, we see that this is not true, that both beta and omega aren't asymptotically independent. And so, now we kind of sort of the work that I've been doing was developing this new step 1 screening statistic. So the next thing that I did was to propose to use a main effects model. So this is basically pretty much the same model that we had before, except now we're going to be adding the exposure effect. So we could think of this as sort of the genetic effect conditioned on the exposure. And we propose to use this as sort of the model for step 1. And so then instead of using beta G to be doing all the step 1 prioritization, we propose to use omega G to do this prioritization. And so again, we have the same question: are omega G and gamma G by E asymptotically independent? And under certain conditions, we're able to prove that they are, and that's given in the following theorem. So theorem has a lot of words. What's most important is that under the null hypothesis of no interaction effect, one can show that omega G and gamma G by E are asymptotically independent, provided that model 2 is correctly specified. This is, again, a strong assumption to have for the effect, but we've shown that even in our simulations under minor model misspecification, we seem to retain the family-wise error rate at the nominal level still. So this brings us up to our numerical studies. So first we'll talk about some simulations I ran. So to assess type 1 error and power, we decided to look at 10,000 replicate data sets where we have 1,000 individuals and 10,000 genes of interest. These genes are drawn from a standard multivariate normal density, which assumes independence across all genes. But I was able to also use, structured correlation, a correlation structure to sort of simulate correlated genes in future simulations too. We assume a binary exposure, E with equal probability. And then Serawa times are drawn from the following exponential model, where we set the baseline hazard to be 0.01, and we have censoring times being drawn from an exponential distribution with the rate parameter 0.005. And I believe this corresponded to about 40% censoring, if I remember correctly, under these specific parameters. And we decided to compare the following methods. So we had the standard GWIS approach, which was what we said before. We tested the hypothesis, gamma G by E equaling 0, and then using a Bonferroni correction to basically control for the number of tests that we're running. The next one was this marginal G association for step 1 screening. So this was that Kuperberg-LeBlanc approach. So this is using this statistic in step 1. The CG by G by E, which is the next one, uses this statistic in step 1 instead of beta G. And then we, for the two-step approaches that we looked at subset testing with a screening p-value threshold of 0.05 and the weighted Bonferroni correction with the initial bin size of B equaling 5 for the step 2 hypothesis test. And again, here phi minus error rate is just the probability of detecting any effect at the nominal level of 0.05. So in theory, what we'd expect to see is that all these values here would be close to 0.05. For the standard GWIS, we see that this is true. Under several different scenarios, this is having an exposure being weak, no exposure effect, a weak and a mild to strong exposure effect. This is looking at different correlation structures, different exposure probabilities, and different levels of censoring. And across all levels, we could see that for the standard GWIS, we retain alpha at the nominal level, which is expected, right? This is what we want to see. But when we use the marginal G approach that we saw before, we have this inflation in type 1 error. And in fact, this inflation in type 1 error seems to be a function of gamma E, right? So we can see that if there was no gamma E effect, as it is here, we do retain for all 3 approaches, the phi minus error rate is at the nominal level, but then as we sort of increase the strength of gamma E, we can see that the phi minus error rate is not preserved for the marginal gene step 1 approach, but for for the conditional G step 2 approach or 2-step approach, it seems to be retaining alpha at the nominal level.
Can I ask a quick question?
Yes.
I mean, binning in the second stage is obviously a reasonable thing to do, and there's all sorts of methods that do that kind of thing. But it sort of begs the question: why bin? I mean, you can't choose. You're choosing the bin size arbitrarily. So, what happens if you don't bin, or equivalently, you use bins of size 1? Has anyone looked at that?
If you use bins of size 1, I think we haven't looked at that. I do know that binning, for the most part, affects power rather than the phi minus error rate. So we should expect the phi minus error rate to stay the same, but it can possibly affect power. And I think it depends on the scenario of interest. I have done simulations where we looked at bins of size 2, bins of size 10, and it's not like it linearly increases or decreases. So I think there is kind of like a sweet spot, but again, it's hard to find what that spot would be.
So is there any intuition for what you're gaining by binning? Because it does feel like it's an approximation of something, right? In some sense, each thing should have its own test level.
Or you may remember that I've explored that for a while, where the second stage testing threshold was a continuous function of the first stage test. And the improvement in power proved to be pretty minimal, although it does, again, preserve the type 1 error rate if you choose the formula for the second stage testing appropriately. But I agree, the idea of binning has always seemed kind of arbitrary to me.
I mean, it feels like the continuous one should be the right way to do it in some sense, but you must be gaining something by binning, right? Somehow you're reducing noise or something.
I don't think that you really gain anything, but you don't lose much. I could try to resurrect my old emails, which summarized that if you're interested.
Also, that brought up a good point of arbitrary bin size, because that's actually the next part of my talk on developing a new method to sort of create a hybrid between the subset and weighted and binning approach that doesn't look at arbitrary bin size or arbitrary capping of bin sizes. So maybe I can partially answer that question in the next part of this talk. So maybe we could just kind of hold off until then. But yeah, the idea here is that either the subset or weighted approach, you retain the familiarity rate at the nominal level using the conditional gene effect rather than the marginal gene effect in step one. Again, theorem one was under the assumption that the model was correctly specified. This is oftentimes unmet due to certain things like significant interaction terms, omitted covariates, etc. So kind of to assess the type of error rate under an incorrect model, we generate several times based on the following model, where we add this additional covariate V and the effect of gamma V. But in the modeling, both for step one and step two, we omit V from that process, right? So the true data is generated using this covariate V, but it's omitted from the modeling.
So can I ask, is that equivalent to allowing E to be continuous, but with a misspecified non-log linear approach model?
I believe a little bit, and that depends on the structure of V. So I have V being continuous, V being uniform, and V being categorical. So you can sort of see how this exposure term will be absorbed into either one of these categories, right? So in the continuous form, I think it is having more or less a continuous E that's being misspecified. Maybe less so for the uniform case because you're bound by 0 and 1. And then for the categorical case, it's a little bit strange because you're just looking at 0, 1, and then I think this category was 0, 1, 2. So yeah, I guess it is sort of, you can view this as like a misspecification of E under certain ranges for that misspecification. And so for this, as I said before, answering Duncan's question, V, we assume takes many forms: continuous, uniform, and categorical, with different strengths of V. So V being very strongly negative to positive to being very strongly negatively affecting the survival. And again, for the GWIS, we retain the type of error at the nominal level. We still see this inflation in using the marginal G approach, which was expected because we kind of saw that same result in the correctly specified scenario. And then for the conditional G approach that we are proposing, you see that the type 1 error rate is still fairly retained at the nominal level. So lastly, we didn't want to look at power, right? So all we did was look at if Fanway's error rate was retained using this new two-step approach. But now we want to see if power is actually improved rather versus the standard GWIS approach. So in this case, we simulate one gene being designated as having a true G/E effect. We vary the strength of that interaction effect from log 0.65 to log 0.8. This corresponds to a hazard ratio of 0.65 to a hazard ratio of 0.8. And consider the following scenarios. One where we have just only a G/E effect. One where we have a G/E effect and a moderate exposure effect. This would correspond to one where we have this crossing kind of effect where we have a strong genetic effect going the opposite direction as both the exposure and the interaction. And then this one is having them all kind of go into the same direction. For the purposes of this talk, we kind of only compare the standard GWIS to the CG G/E approach because, as we saw before, using the marginal statistic in step 1 didn't preserve the type 1 error. And you can see that across most of the scenarios, we do have an improvement in power. The one that we don't have an improvement in power over the GWIS is the crossing approach that we have here, where the genetic effect is strongly negative, but this was sort of expected. And in fact, if you were to pull this a bit more to the right we do see a gain in power happening at some point. But in general, we can see that the weighted approach seems to be performing better than the subset approach, which has been kind of shown in previous studies. And both of these do better than the standard GWIS. I know I'm kind of running out a little bit of time, so I'll be kind of skimming through the real data application before I go into the next part of my talk. But the real data application that we have here was to sort of do this in practice, was to look at a chemotherapy study for breast cancer patients. We have we have about 1,700 gene expression levels that were measured on 614 patients after pre-processing. And then the outcome of interest here was distant relapse-free survival with a survival rate of approximately 22%. So this is sort of how the G/E p-values looked for the subset approach. So we could see here that the main thing to look at here is that under the step 2, under the standard GWIS, we only identified 3 effects. These are the 3 that were detected. But under the 2-step approach using the subset based testing, we were able to identify 2 more. And those are the 2 that are here in the triangle symbols over here. When we looked at the weighted Bonferroni correction, this is how kind of you can arrange these p-values, and we can see this is bin 1, bin 2, bin 3, bin 4. At least for the first 4 bins, just for graphical purposes, I cut it to the first 4 bins. We could see that this blue line, again, anything passing this is the standard GWIS, and then anything passing the red lines will be in the weighted Bonferroni, will be G/E interactions that are significant at the weighted Bonferroni corrected significance level. And so overall, if you look at the results, we can see that using the GWIS, you're only able to identify 3 G/E effects. For the subset approach, we're able to identify those same 3 as well as 2 extra ones. And for the weighted approach, we're able to identify 2 of the same ones, but then 2 that weren't identified with either approach. Now, again, this kind of is a little weird because we said that the weighted approach seems to be providing the best power. So why aren't these all necessary subsets of each other? And that's sort of the issue with real data, especially when you have correlation among gene expression levels that isn't being taken into account. But the idea here is that we can identify more gene expressions or G/E interactions that we wouldn't have been able to find using a standard GWIS. So the conclusion for this part of the talk was that 2-step GWIS approaches can be applied to improve power for the Cox model for right sensor data. And we showed that conditioning on the exposure is necessary to preserve the type 1 error rate. And some next steps here, again, the theorem that I showed was under the model being correctly specified. But we want to generalize our results under a model misspecification, which includes using a robust standard error estimator. The second thing was looking at how correlated genes can impact both the step 1 and step 2 procedures. We also want to find more sophisticated ways to incorporate exposure into step 1. Right now, we're using it as like a main effect that we're conditioning on, but using it as a stratification variable if it was categorical binary, or maybe some other more complex way of modeling E can be used as the screening statistic. And then lastly, kind of as I repeated earlier, is to account for correlation between genes and testing procedure. And so that's sort of the first part of the talk, kind of work that I've done. This has been recently published in Statistics in Medicine as of, I think, a few days ago. But there's still a lot of room to work on here. What I'm trying to do with my pilot project is to sort of extend this to the idea of sample cohort design. So under a nested case control or case cohort scenario where we kind of oversample exposures or oversample cases, is there a way to sort of take into account the exposure in a more sophisticated manner? And that's something that I've been trying to explore and look at as part of the pilot project. The next part I want to talk about, which hopefully can answer Paul's question, and hopefully I could get through this in the next 5 or 10 minutes, is to improve step 1 via this hybrid screening approach, kind of taking the best of both worlds of subset and weighted Bonferroni. So again, as we said before, the subset-based screening approach, pros are that it's p-value based, so it's data-driven, but the main con is that it's this dichotomous pass-fail rule. So many interaction tests won't be tested. For the weighted Bonferroni screening, the good thing is that each interaction term is tested, but the con is that the binning is dependent on the initial bin size, which isn't data driven, right? Kind of like what Paul was saying. You can use 5, you can use 1, you can use 2. What's stopping you from using a different value? Both approaches require an auxiliary tuning parameter, and the goal of this was to sort of develop an approach that combines the two aforementioned screening rules. The main motivation behind this method was suppose that we have M genes again, and you want to consider beta G as some screening statistic in step 1. Under the null hypothesis, the p-values under the null hypothesis, the p-values should be uniformly distributed between 0 and 1. So we can expect that 5 of these p-values to be less than 5 over capital M, 10 to be between 5 and 15 over M, so on and so forth, just by virtue of the p-values being uniformly distributed. And in this case, the binnings here should be in expectation the same as the weighted Bonferroni approach. So if the initial bin size was 5, then we also expect that those 5 p-values to be less than 5 over M. If you have the next 10 should be between 5 and 15, and so on and so forth. But in practice, p-values may not be uniformly distributed, and generally they're probably going to be skewed towards lower values, mainly because the null hypothesis won't hold for every gene. This can happen when you have known GWAS hits, maybe unknown GWAS hits that weren't previously detected, maybe when we have genetic correlation. So what this means is that it's possible that more genes will be in the first few bins than we would anticipate. And what this does is what we call this phenomenon of flooding of earlier, or flooding of these high power bins. Because if we expect only 5 p-values to be less than 5 over capital M, but in fact there's 80 or 100 of them, then each of those are going to actually be in bins 1, 2, 3, and 4. And then so in expectation, the other bins are kind of the other SNPs in the other bins are shifted downwards in that ordering if you were to look at the weighted Bonferroni approach. Subset-based approaches are robust to departures from the null hypothesis, mainly because there is no cap on the number of genes in the subset. All we care about is if the p-value for the screening statistic was less than alpha naught. But the weighted Bonferroni approach will be sensitive because you have these arbitrary caps, the bin sizes. So what we propose is this expectation-based ranking, which doesn't assume fixed bin sizes, but instead bins these tests based off of p-value thresholds. So for example, bin 1, you will look at all genes with screening p-values less than 5 over M. For bin 2, we look at all p-values less than 5 to 15 over M, so on and so forth. Each bin is still going to be controlled the same way that we did for the weighted Bonferroni. And we can see that under the null hypothesis, they should be the same, but under a strong flooding, they should be different. And so what we anticipate to see is that under little to no bin flooding, this performs similarly to the weighted Bonferroni approach. Under severe bin flooding, this should perform better than the weighted Bonferroni and hopefully subset screening. The second part of the motivation behind this new approach is either way in step 2, we're doing a Bonferroni type correction. We're either dividing by the number of genes that pass step 1 for subset, or we divide by the number of genes in bin BK for the weighted Bonferroni or expectation-based range approach that we have. This can still be overly conservative due to not taking into account genetic correlation. That's sort of what we were trying to sidestep for the original GWIS. And so is there a way we could sort of improve this? One possible solution of many to take into account genetic correlation is to adjust correlated tests as if they were independent according to some effective number of independent tests. And the way you could do this, this calculation of effective number of tests, is to use the correlation matrix to estimate the effective number of tests, M effective or M sub F, via principal components analysis. The reason being is that the total amount of correlation among traits in a set can be measured by the variance of the eigenvalues derived from the correlation matrix. So more specifically, M effective is going to be a function of the vector of eigenvalues provided through PCA. There are many ways to kind of calculate M effective. Joshua Milstein and I have been developing our own to do this, but 2 that have been kind of seen in the literature were proposed by Lee and G and Gao et al., where you kind of use the function of the absolute value of the eigenvalues to kind of summarize the M effective here. For Gao et al., it's a bit more of an ad hoc procedure where you kind of essentially find the number of POCs that jointly contribute to some percent variation that we find in the data. By default, they pick C to be 0.995, which corresponds to finding the number of POCs that jointly contribute to about 99.5% of the variation. And in their extensive numerical studies, they show that their approach works fairly works similarly to the permutation approach, which is sort of the gold standard in doing in adjusting for correlated tests, but with much less of a computational burden. So applying MF in practice, it requires, number one, the calculation of a correlation matrix and PCA on the corresponding matrix. And this can be computationally taxing for large M, right? So you can't do this genome-wide, right? To calculate a 1 million by 1 million correlation matrix and then doing PCA is just nearly impossible. But under two-step hypothesis testing, we only need to take into account correlations within the subset or within the bin. And so again, these numbers are going to be much smaller than capital M. So it'd be easier to derive a correlation matrix and easier and quicker to do a PCA on them. So how we would do this for the two approaches, or three approaches if you include our expectation-based ranking approach. So if we let X be this N by M matrix of omic measurements, then for subset-based testing, we kind of do the same thing we did before. We let A be the indices of genes that pass step 1. And then we calculate M effective based off of the submatrix X sub A. So when you're looking at the indices of genes that pass step 1, we calculate MF either using the Lee and G approach or the Gal approach or whatever approach you want to use. And then for each J and A, we test the corresponding interaction statistic against the threshold alpha over M effective rather than alpha over the cardinality of A. You can then kind of do the same thing for rank-based testing, so I won't go over that, but a very similar approach. And so this is still preliminary work. This is work that I've been working on. This is ongoing work that I've been doing. So I will just go over some preliminary results that we have. We look at a quantitative trait here. We assume that the exposure variable is binary. G is going to be like a large genetic matrix that kind of is formed blockwise, where each column of GJ is trichotomized based on the minor allele frequencies. And then we kind of simulate sort of block correlation structures based off of the LD matrix from a sampled region of the 1000 Genomes project. And we do this across, so we have a 20 by 20 block. So we have an N by 20 block, and we repeat this, I believe, 500 times, such that the number hits 10,000. So we have correlation within block, but independence across block. We assume that we have one true G by E effect along with a main G and E effect with the following effect sizes. And then we also, to simulate flooding of bins, flooding of the top bins, as we said before, we generate these main G only effects. So these only have marginal effects, but not G by E effects. We then kind of assume that the expected R squared for each G only effect is the same. And then for step 1, we use this marginal Y on G statistic to sort of come up with the screening statistic for step 1. So what we expect to see here is that under independence and under no main G only effects, so there's only one effect, which is this G by E effect, along with its corresponding G and E effect, is that the United-Laza weighted Bonferroni approach and the expectation-based ranked approach should work similarly, and both should work better than the subset approach. But once we have these main G-only effects, obviously those Y on G statistics will be large. The p-values will be smaller since the null hypothesis isn't true for these. And so we would expect this flooding of the top bins when we have these main G-only effects. And that's based off of the number of G-only effects and also the size of the G-only effects. And we sort of look at both in our simulations. So we calculate family as error rate and power as we looked at before. And so what we can see here is the standard GWIS is sort of like the baseline measurement. And under no G-only effect, we can see that the weighted and expectation-based ranked approach perform similarly at about 70–71% power, and both perform better than the subset and standard approach, as well as the family error rate being retained at the nominal level, except for the subset approach. It seems like it's a little too liberal when you look at the corrections, but the corrections that we have for the weighted approach seems to not be inflating the type 1 error rate that badly, or at all, sorry. When we have 20 G-only effects, we can see that the weighted Bonferroni approach now performs worse than the expectation-based ranked approach. The subset approach is still kind of robust, right? Before it was 63%, now it's 63%. But for the weighted approach, it was 71, and now it's 64. Expectation-based ranking was about 70, now it's about 68, but it's less sensitive. So we can see that the EBR approach sort of has better power than the weighted approach. And this is mainly because you're flooding the top bins. And when you flood the top bins, and obviously the significant effect can be pushed down to the lower bins, giving it a much smaller threshold to overcome to be detected as to be found as significant. Family error rate has the same pattern as it did before, with the subset approach using the corrections having slightly larger than nominal type 1 error rate. When you have 80 G-only effects, you can see that in this case, the weighted approach performs much poorer than before at 64% to 49%, but the expectation base kind of only decreases from 69 to about 65%. So, having more G-only effects really affects the weighted Bonferroni approach, but doesn't really affect the subset and expectation-based ranked approach that much. And then again, you could do this by looking at just the effect size, by looking at the effect sizes instead of the number of G-only effects. And we'll see a very similar relationship where the weighted Bonferroni approach performs poorer than the expectation-based ranked approach, especially under larger marginal effects. So kind of just the main takeaways behind this is that the expectation-based ranked step 2 or two-step procedure performs as well as the weighted approach when no G-only effects are present, which is good because it means it's not worse than the weighted Bonferroni, but it actually outperforms both the subset and weighted approaches when strong G-only effects are present. For ABR, both the GAU and the NG correction kind of provide closer nominal family error rate with a slight improvement in power. And we've seen that it can potentially produce inflated error rates for the other approaches. Further investigation is still required to kind of see, why this is so. And so next steps, of course, is to kind of do numerical results for other types of outcomes. So case control studies with a binary trait. Again, kind of what I talked about before, time to event traits. Currently, I looked at the marginal Y on G kind of screening as the step 1 screening statistics. So looking at how this works for other type of step 1 screening statistics would be helpful. And then a real data application that I've been kind of working on alongside Andre Kim, who's also a postdoc in the department, into looking at GWIS studies using the Fiji data, and again, investigation into possible inflation of family error rate for the other two approaches is something else that I want to look at. And I think that's all I have. I know I went over a little bit of time. It's 12:58, and I want to kind of get through any kind of questions people have. But yeah, thank you for allowing me to just share the recent work that I've done. Sorry for going a little fast towards the last half of my talk. I'm happy to share these slides with anybody. And at this time, I'll take any questions.
Any additional questions? I know people had some throughout, so
unless I missed it, you're just using outcome by G statistics as your first step screening. Is there any analog to the case control approach of using a GE association for the first step?
I think there is. Again, this is only for a I simulate data here using a quantitative trait, so not a binary trait. But I do think that using sort of that the EG relationship can work as well. I haven't tried it out yet, and that's actually one of the things I wanted to look at when I mentioned this point about generalizability to other screening statistics. I don't see why it wouldn't, but we'd have to simulate the data to see if it's actually true.
Well, the case control approach relies on the oversampling of cases relative to controls. And if you're going to use the entire cohort, there's no such analog. That's why I'm wondering whether there is any, in fact, any analog.
Are you talking about this with respect to the time to event?
Yeah. That's
oh,
what
yeah,
I'm
sorry.
talking about.
Okay, got it. Yeah, so there is no oversampling, which is exactly why you wouldn't expect any sort of E on G effect for that. That's why that's why kind of like the motivation behind my pilot project was to extend this to nested case control studies and case cohort studies to see if we can use we can use the E on G statistic as you referred to, as well as maybe a combination of that with the Y on G statistic. Because under those, under a case cohort or a nested case control design, you are oversampling cases. So I would expect there to be some benefit in using that, but again, that's sort of the basis of the pilot project that I'm working on.
Thank you. Nice talk.
This may be something you don't want to think about, but just out of interest, is it possible to characterize the situations in which, or the circumstances under which these two-step approaches just don't work? Or putting a more positive spin on it, can you characterize the situations in which they work best? It's a very vague question, but.
Yeah, no, I think that is a good question. I think one thing you can see is this study here, right? So under this scenario, where we have this crossing style interaction effect, again, right, we have here number 3, where the genetic component has a strong effect going the opposite direction as both the exposure and the interaction effect. Under this case, we see that the standard GWIS actually performs better than the subset or weighted approach. I believe if you pull this out more to the right, it does kind of overcome that hurdle and perform better, but it is possible that in these conditions, especially when you have this crossing style interaction going on, that the standard GWIS can perform better. It seems kind of weird, but that's, I guess, one of the scenarios in which we can see that it would perform unfavorably. And other approaches that I've seen, like what we have here, when we have kind of them all going in the same direction, or if it's even just having a G by E effect and no main E or G effect, the two-step approaches seems to be performing quite well. This has also been, I think, validated through other studies too, which kind of show the same type of relationship. So there are, I won't say that two-step hypothesis testing is the best all the time. There are certain kind of edge cases where it may perform unfavorably, and this is one of them that we can see in panel C.
Thanks.
Okay. Any additional questions, thoughts, comments? We're a little bit over the hour, so if not, Eric, thank you very much. And everybody else, thank you for attending the seminar. No seminar next week, faculty meeting, but we will pick up again in 2 weeks. Thank you.